Here we explore various things about science, history, technology, and many other subjects that I'm interested in. So today, I'm going to talk about a topic that has been going viral in the mass media as well. This is specifically about a disease, but this disease is a virus, and most of us think that this virus will be the next pandemic. So, will it be? Well, let's see in the video. First, let me introduce this virus to you guys. This virus is the Hantavirus. The Hantavirus was named after the Hantan River in South Korea, where it was originally discovered. Now, sit back, relax, and enjoy this video. So, what is the hantavirus? Well, actually, it's not a single virus, but a family of viruses which is carried by wild rodents, which include rats and mice. Causes are rare but severe, and they cause two main life-threatening diseases. The hantavirus pulmonary syndrome, or HPS for short, which is caused in the lungs and is occurred in the Americas, and hemorrhagic fever with renal syndrome, or HFRS, which takes place in the kidneys and is more common in Europe and Asia. Most strains are not contagious among humans. However, there is one hantavirus strain which is known as the Andes virus, which is in Argentina and Chile. This virus is known to spread between human to human. Now then, where does it come from? Well, it comes from some natural carriers who are deer mice, white-footed mice, and some rats. Now these rats and mice, they are known as rodents. These rodents remain healthy because they evolved with the virus and they became immune to it. So these rodents are mostly found in rural areas, cabins, barns, and rodent-infested spaces. Well, how does it spread? Its main route is by inhaling airborne particles from rodent urine, droppings, or saliva. Now, how do these become airborne, you may ask? Well, when you engage in risky activities such as sweeping or vacuuming, these particles may become airborne and you may inhale them. So, it is mostly by inhaling that this virus spreads. Other routes include animal bites or direct contact with the animal waste. However, with the Andes virus, as I told you before, human-to-human transmission is possible. Now, I will tell you some symptoms that you may notice after you get the hantavirus and how does this virus progress. Well, the risky thing about the hantavirus is that it has a long incubation period, which means basically a period in which the virus takes to develop inside our body and we notice symptoms. This may take from 1 week to 8 weeks. This means that you might go on 2 months not aware that you have got the hantavirus. So the early symptoms might include a severe case of the flu, like fever, chills, muscle aches, dizziness, and fatigue. Later, these acute symptoms may progress into HPS, or Hantavirus pulmonary syndrome, which takes place in the lungs and which causes cough, shortness of breath, and the fluid buildup in lungs. And HFRS, which is the hemorrhagic fever with renal syndrome, which can take place in the kidneys. This can cause abdominal pain, kidney failure, and bleeding. Patients can deteriorate rapidly due to fluid buildup or kidney failure. So this virus is very risky. So hantavirus, how deadly you are? I mean, why should I ask that from a virus? It can't talk. I should tell it myself. So actually, the mortality rate for the virus is about 38% to 50% and is very high compared to the coronavirus. This is also because there's no specific antiviral treatment. Now, if you take the COVID-19 virus, then it has lots of different vaccines. But for the Hantavirus, since it was newly noticed, it still doesn't have a proper medical treatment. However, there is one way we can provide it. This is by using supportive care, which includes oxygen therapy, fluids, and ICU. These improve survival, and early diagnosis is very critical when it comes to the Hantavirus. Now, I will tell you about the newest outbreak, the most latest outbreak of Hantavirus, which has captured everyone's attention. Now, this was a Dutch cruise ship in the month of May, which was boarded from Ushuaia, Argentina to Cabo Verde. The name of the ship is MV Honduras. Now, there have been 13 reported cases and 3 tragical deaths of this virus. The strain in question of the Hantavirus was the Andes virus, which is reported to have human-to-human transmission. It was spread among the passengers, and these passengers are currently quarantined in their current cabins. Authorities contain the outbreak, luckily, so the public risk remains low. Now, this is for the ones who are living in Sri Lanka, just as I am. So, you might ask a very reasonable question. Has this virus arrived in Sri Lanka? Well, potentially, yes, it has arrived. Because not only in 2026, but also all the way back in 1986, which is about 40 years back, this virus was first diagnosed by a patient. This was known as the Lanka virus back then. Now, this is the moment all of you have been waiting for. Should we be worried about this virus? Well, of course not. We should not be worried about this because it is not as contagious as the COVID-19 virus, and it won't turn into the next episode of COVID-19 and the pandemic, as everyone has been thinking. All of you guys have been overthinking about this and being anxious. So this is not another COVID episode, but even though it is a rare virus, it is still very severe. So we should always try and avoid it. However, the international health authorities are stepping in to actively contain these outbreaks. However, higher vigilance is needed for the rural property owners, outdoor workers, campers, and eco-tourists in the Americas by preventing these rodents from spreading the diseases among humans. Now, I will tell you guys how to prevent this virus and how to recognize people who are infected. So, in order to recognize people who are infected, it is very simple. Just take a swab out of your cheek, and then this is known as a PCR, where they examine the properties of the saliva, such as the DNA, for tracing the presence of the virus. You can also take blood tests to detect hantavirus infections. So, how can we prevent this virus actually? Well, we can use rodent proofing methods, such as seeding entry points where rodents such as rats and mice might enter, and we should also store food safely so that they might not get contaminated. Also, we should use safe cleaning methods. We should not use directly sweeping or vacuuming in different places which are rodent infested. Instead, we should use disinfectant spray, masks, and gloves. This message is for all the campers and travelers who are out there. You guys should always avoid rodent infested areas, keep your food sealed, and ventilate cabins before use. And always remember this, you should always treat rodent waste as hazardous. So this will keep the virus from spreading among humans and keep all of us safe. So, my final message to you guys is this. Do not be afraid of this virus because it is not as risky as the ones we have witnessed previously. And we can defend this virus by using the tips that I just told you before. So most people are getting cheated by these false rumors that are spreading around the internet and other mass media. So you should always remember what I said and try to prevent the virus. And let's beat this virus out of the planet. Now, I would like to thank two important individuals who have helped this video to be what it is. Dr. Nandini, who was my beloved pediatrician ever since I was small, and Dr. Gayana, who is a renowned clinical microbiologist who works in Sri Lanka. So, thank you once again, Dr. Nandini and Dr. Gayana. Thank you very much for listening to this video. If you enjoyed it, click the like button, comment your ideas down, and most importantly, subscribe to Beyond Infinity by Cyril. I hope that you learned something valuable from this video. If you did, share this video among your friends and family so that they get to be aware about the Hantavirus. So, I wish you a safe life and a life free of Hantavirus. Till then, let me give this punch which will ward all of the Hantavirus of the earth.